Does RTT therapy get results? Is it effective? I'm going to share with you real experience and real data about the effectiveness of RTT therapy. But before I do that, let me talk about the effectiveness generally of hypnotherapy and hypnosis. And let me introduce myself. I'm Jonathan Butler and I am a clinical hypnotherapist, an RTT therapist and a mindset coach, using hypnotherapy and coaching to move people from where they are to where they want to get to. So talking about hypnotherapy, there is a huge body of evidence that shows the effectiveness, the efficacy of hypnotherapy. There are lots of studies which show how effective hypnotherapy, hypnosis are in comparison to traditional talking therapies in terms of the results that they get, the speed that they get results with. So there's lots of evidence around that. It is a very effective treatment. And you can go to Google and look some of this stuff up. You can go to a site such as the Royal College of Psychiatrists, who talk about the efficiency, the effectiveness of hypnotherapy. They talk about how it is effective, how it is proven to get good results for things like pain relief, for insomnia, for anxiety, for various fears of flying, for weight loss, even for helping relieve pain in cancer patients and other serious medical conditions such as that. So there are many, many things that hypnosis is proven to be effective in. There's also lots of anecdotal evidence. You can come across lots of people who've had really amazing results with hypnotherapy when they've tried everything else. So there are lots of things that it's proven to work for. And it's really, really powerful that there is this body of evidence, because for alternative therapies, which hypnotherapy is considered to be, basically anything that doesn't involve drugs is regarded as an alternative therapy in a lot of circles. And it's very, very hard for people to get the body of evidence that a medical organisation like the NHS will take seriously, because frankly, you have to have the budget of a pharmaceutical company to be able to do these things. Pharmaceutical companies spend billions of pounds on clinical trials to prove their drugs. They have a big body of evidence. And the fact is, there is nobody out there doing any kind of alternative therapy who has the funding, who has the resources to do those kind of clinical trials. So the fact that there is this large body of evidence over a long time that shows the effectiveness of hypnotherapy makes this really, really good evidence. So, okay, so I've talked about hypnotherapy and how effective that can be, and I do suggest you go and look that up. But then let's get into talking about RTT, because RTT is a type of hypnotherapy, but it is a more comprehensive type of hypnotherapy, okay? So I've got another video which talks about the differences between RTT and hypnotherapy, but basically RTT typically goes further than most other forms of hypnotherapy. So hypnotherapy is really about relaxing people, getting them into a brain state where they are relaxed, where they are receptive to suggestion, where they can take on board new thoughts, new ideas, new feelings, and even new actions. RTT goes even further than that, in that in dealing with complex issues, it aims to deal with the root cause. It works on the basis of you can't fix rather what you don't understand. So rather than trying to deal with the root cause, trying to deal with the symptoms, RTT was invented. It was first specialised in working with people with eating disorders. So rather than just treating somebody who's got bulimia or some other eating disorder, it was really discovered that if you actually go to the root cause, rather than just trying to treat the symptom, understand why did they do that? Why have they got that relationship with food? What's actually going on? Because when you fix the root cause, when you understand the root cause, you can fix the root cause and you can deal with the symptom and probably all the other symptoms that are going on. Because generally, if somebody's got anxiety or insomnia or something like that, these symptoms usually don't exist in isolation. People have a whole bunch of other things going on. So when you deal with the root cause, all these things can come under control. So RTT is more than hypnotherapy. It is more comprehensive in general. There are lots of different modalities. So that means that it is, in some ways, in my experience, even more, in fact, in my experience, it is even more powerful. And so I tend to use RTT therapy for things that I regard to be complex, to be deep-rooted. So if someone comes to me for maybe stopping smoking or maybe for weight loss, generally speaking, I would treat that with regular hypnotherapy, hypnosis and suggestion. Where I think there are more complicated things going on, for me, that's not enough. You need to do that root cause analysis. You need to get to that. And in RTT therapy, it is about get to the root cause, help people let go of it, then give them that reprogramming they want to have, and then reinforce it in the period afterwards. So my experience, RTT is very powerful, very effective for treating simple things right through to incredibly complex, deep-rooted things that have been with people for a long time. So let's actually talk about those results then, because there's lots of anecdotes out there, but actually let's talk about some evidence. I've talked about the general evidence for hypnotherapy, for hypnosis, and that RTT is a form of hypnotherapy. But myself and several colleagues, we were working together over a couple of years, and we were working under a regime where we put in place an outcome recording system. It was using a kind of a standard methodology that if you've ever done CBT or something like that through a healthcare provider, you've probably filled in those papers where people ask you about how you're feeling, how you're getting on, what's going on for you when you start it and when you end it. So that was basically what we did. And what we did was, before we did a session with people, we would ask them these series of questions about how they're thinking, how they're feeling, how they feel about themselves. And at the end of it, after 21 days, because an RTT session is like a 21-day process, okay? At the end of that 21 days, we would ask them those same questions again and ask them to score them. And we'd measure that, measure the change between where they started and where they finished after the 21 days. And so to put that into context, so talking about my own results over that period of time, 84% of the people that I did an RTT session with after 21 days said that they had made, well, they're not just said, obviously we talked about it as well, but in terms of the scores they gave, showed that they had made significant progress. And that was making more than a 30% improvement in how they were feeling from the beginning of that period to the end of that 21-day period. So that's 84% after just one RTT therapy session. And for those people who did 2 sessions, that rose up to being above 90%. That was my personal experience. So, I've anecdotally seen that things have worked, and I've seen by measuring this myself that people make significant improvements. And of course, asking questions and asking people to score things it's not a perfect system, but it's a very good indicator. When you ask somebody, for example, one of the typical questions would be, if someone's coming to you with anxiety, how anxious do you feel on a scale of 1 to 10? When you see them from going, they're like 8 out of 10 anxious to going, I'm 4 out of 10 anxious. And you see when you're talking to them, that change in them. These things are really, really significant. So RTT therapy does work. Hypnotherapy does work. Anecdotally, you see it, and there is a whole body of evidence out there. So it is a very effective therapy. I would suggest in a lot of cases it is more effective than kind of regular hypnotherapy, but there are lots of levels of hypnotherapy out there. And again, with RTT therapy, people are very well trained to become an RTT therapist. You have to go through a process of being a practitioner, a therapist, of being accredited, and it is a very thorough process. People pay a lot of money to be trained in this. It's a very good course, it's a very good support. So, you're dealing with people who are well qualified to do what they do. And if you would like to subscribe and comment below if you've got any questions, I'll happily answer those. And in my next video, look out for this. And again, if you subscribe, this will come up to you straight away. I'm going to then answer the question, which I also get often as a follow-on to this, which is do the benefits of doing an RTT therapy session last? Do they go beyond that 21 days? So I'll share that with you in my next video. So please do like and subscribe, and I look forward to sharing that next video with you.